Hello class, my name is Trisha Miller, and today I'm going to be talking to you about communication. The core value of communication. Communication is one of the 7 core values of the RN to BSN program. Communication is defined as the exchange of information between 2 or more people. This can occur in many different ways. Communication can be verbal, nonverbal, or written. Listening is also an important part of communication. Communication can be achieved while using technology such as phones and computers. Communication is important to nursing in many ways. Nurses need to be able to effectively communicate with patient, family members, and other providers. Effective communication can affect the quality and safety of patient care. I'm going to be discussing the different types of communication and how nurses can improve communication. There are 3 main types of communication. The first type of communication is verbal. This is the most obvious type. Nurses communicate with patients, family members, and providers multiple times every day. Nurses communicate verbally in person and on the phone throughout the patient's stay in the hospital. Another form of communication is nonverbal. Nonverbal communication can occur at the same time as verbal. Examples of nonverbal communication are facial expressions, body language, touch, and eye contact or lack of. Sometimes nonverbal communication expresses more than what you say verbally. If a nurse is talking to a patient but keeps looking at her watch or the doorway while doing so, she is saying that she doesn't have time for the patient. The third main type of communication is written. Nurses use written communication when giving discharge instructions to patients. Providers use written communication by writing orders for nurses to execute. In order to effectively communicate, nurses must also listen. Taking the time to listen to a patient shows compassion and caring. It also can help with assessing a patient's physical and mental well-being. Listening to patients helps build a trusting relationship, nurse-to-patient relationship. It makes the patient feel cared for. The problem with all forms of communication is that the message can be misinterpreted by the receiver. Even with verbal and written communication, the message may not be received as intended. One way that nurses can ensure that the patient understands the information that they are trying to convey is by the teach-back method. The nurse educates the patient and or family verbally and with written instructions. Then the patient repeats the message back to the nurse to ensure understanding. This method is also used when nurses repeat a verbal order back to the provider to ensure accuracy. Another way to improve communication, especially with patients and family members, is to use language that is easy to understand. Medical terms are okay to use when speaking with providers and coworkers, but when speaking with patients, nurses need to use terms that they will understand. In conclusion, communication is a core value of the RN BSN program. Communication is an integral part of nursing and the care we give patients. The main ways of communicating are verbal, nonverbal, and written. Since communication is a vital part of nursing, we should always strive to improve our methods and make it more effective. Thank you for your time. Bye.